Hey everybody, this is a technique I want to show you of what I'm going to be doing in Vancouver in October for facet joint needling. I've never actually demonstrated in any of my courses. This here is the spine. This is the cervical spine itself. And so what happens is these here are the facet joints. They're zygapophyseal joints and they glide in the cervical spine. So when someone has a problem with range of movement, a lot of times you get these joints are either jammed or not moving because you have muscles like the scalenes that are attached to them, the longus colli, the muscles along the back, the deeper multifidi muscles. So I actually teach this joint being needled in the supine position. So the patient is on their back, their head is turned, in this case turned to the left, and what we can do here is I palpate the transverse process, and when we palpate it, we're palpating the anterior portion of the transverse process. And then from there, we proceed posteriorly, and then you're massaging or feeling the zygapophyseal joint or the facet joint. And while you're doing that, I do that with one hand, and with the other hand, I get the tube, and essentially we are able to needle right through all of this muscle, and we go right into the joint itself. And a lot of times we needle into the joint, so there's a joint capsule around here, or we'll take it out of the joint and peck on the articular pillar. Because what this does, it causes a relaxation reflex to really improve the arthrokinematics of the neck itself. You can see how the joint itself moves. And so when we do this in the course, of course, we're doing it on real people. So be sure to visit acuvids.com to get registered for that course in Vancouver in October 2019.